Welcome, everyone, to today's LinkedIn Live. This is called Creating Tomorrow's Health, Highlights and Key Takeaways from HIMSS 2024. This was a big conference last week that I attended. My name is Don Woodlock from InterSystems. I'm joined by Jan Bager from GE Healthcare. Before we get started, during our presentation here or during our discussion, you can ask questions in the chat, and we'll get to those questions as well, and you can chat with each other as well. I went to HIMSS, Jan did not. This is the opposite of our last session at RSNA where Jan went and I did not. So in this one, Jan, I'll have you question me about what I saw at HIMSS with a special focus on AI. So I'll take it away.
Absolutely. And Don, great to see you again. It's been a while since we spoke last time, and I was really looking forward to this session because I wanted to learn about what you learned at HIMSS. As you said, I couldn't be there this year. So if you could just start with kind of summarizing a bit your impressions, your learnings, the overall, let's say, theme of the event and so on, that would be great. Thank you.
Sure. I don't know actually what the official theme is, but I'll tell you what kind of the main things, my main impressions were. First of all, it was a very crowded show. You know, HIMSS has gone through a couple years of sort of downturn because of COVID, which was not their fault, but you know, relationship with vendors and then Health and Vive have come in and kind of taken some audience away. But I felt like HIMSS was back. The exhibit area was chock full. The attendees were up. It was a nice, vibrant session, which I think is good for the industry to have these forums to get together. You know, AI was everywhere, and that was my focus also at HIMSS, sort of understanding what all the news was from an AI point of view, and we can dive into that in a second. And then also, you know, an undercurrent was the Change Healthcare hack, you know, which is still down at this point. It was a little bit of a black cloud over or concern, I guess, across the attendees, and that wove its way into a lot of sessions and discussions. So cybersecurity ended up being another big theme, as it should be, but it was extra big at this conference because of those events.
Very interesting. And look, as we want to focus a bit on AI in our conversation here, I mean, I've heard a lot, right? Also here in Europe at events and discussions about, I mean, LLM is on top of everybody's mind. There are a lot of, let's say, companies, health systems, stakeholders exploring like use cases and trying to figure out what can I do with this technology. I mean, is this like the status you see as well, where we are in as an industry, or do you think we are already like ahead of this?
No, I think, well, right now, I think we're all searching for those great use cases for generative AI. And certainly every booth was talking about AI. Every person was talking about AI. It was certainly I felt like everybody was walking around with a hammer, you know, looking for those nails. What was interesting now, though, is I think that the marketplace has, you know, centered around one kind of killer use case, which is this ambient documentation use case. You know, that was kind of all the discussion. So many health systems were trying it. So many vendors were out there, you know, demoing how they handle kind of ambient listening and documentation. And that's really, I think, the killer use case that the industry is getting behind. And I think I mean, to me, it makes sense as a use case. I don't know if you see that in Europe as well. I know the dynamics are a little different in terms of adoption of voice recognition and dictation and that kind of thing. But certainly in the States where that's well adopted, you know, moving to that next level of basically having that ambient experience and having it automatically document in the EMR is really exciting for everyone.
I mean, if we may, let me just zoom out here just very quickly. Look, when I think about like a patient doctor conversation, right, when they sit together, usually my experience is they sit on, let's say, the opposite sides of a desk, of the doctor's desk, and in between them there is this screen where the doctor is reading things, typing things into the computer, right? And this is like making it difficult to have like a human interaction. I mean, what you just described helps on one side, right, of what I just explained, which is like documenting the current, let's say, conversation.
Yes.
But what about the other side of things, where I need to, right, as a doctor, I need to inform myself about the patient context, about the patient history, to have an informed conversation.
Yes.
Do you have seen those kind of use cases as well?
I mean, I think that the whole topic of summarization, because they're both a bit of a summarization task, learning about the patient, getting that summary of the whole record, in a snapshot, is similar to, hey, here's this audio file, or here's this office visit, summarize it for me in a nice structured way. So they're actually similar under the covers from a technical point of view. They are different use cases, cool. But the ambient documentation of the visit it's a little bit of a safer use case if you think about it, because what's happening in that use case is there's a human in the loop in the end. So I'm getting the summary, I'm the physician, I'm getting the summary, I'm reading it, I'm signing it, I'm editing it a bit, signing it, and filing it to the record. So this human in the loop style process is kind of the safest use of LLMs right now. And if you think about its predecessors, like transcription or voice recognition, there's always been a human in the loop. So this is kind of a well-worn road that now gets better with LLM. Summarizing the EMR, if the LLM makes a mistake, let's say, it has more serious safety implications because there's something in the chart that might be important that wasn't presented to the physician. So I know a lot of EMR vendors, we're doing it as well because we have an EMR business outside the US, are working on that summarization use case. So I think that's an awesome use case also, but I think it's going to be after ambient just because of the safety implications. I don't know, what do you think? What are you seeing in Europe on that front?
Look, I'm totally with you. I think like ambient documentation is something that is right, safer to be done, and therefore eventually faster. But when we speak about safety, right, there is this aspect of like regulatory requirement in our industry, right? I mean, we know this very well. All the technologies we want to apply in healthcare, we need to make sure they are safe, they do not harm the patient. So therefore, we need like regulatory guidance on all this. Don, what is your like perspective on this, and what did people talk about this at HIMSS?
So first of all, the regulations have to get caught up with the technology. So I do think regulations in this area are still evolving, and our regulators are still trying to figure out what to do. So I think the industry is sort of waiting on this point. One thing that happened in the States is you have the FDA, which kind of regulates, let's say, radiology models and that sort of thing. And the group called the ONC, the Office of National Coordinator, has sort of been designated to regulate the LLM use in EMR. So at least a regulator has been named in the States. I don't know what it looks like in Europe and Asia from a regulation point of view, but I think regulators need to figure this out. There's aspects that are very similar in terms of the way you build and design software, and you validate it, and you analyze it for safety implications, and you're transparent and honest in your marketing. Those sorts of things can be applied to generative AI, but I think there are kind of special new characteristics that come up. One of the interesting aspects of it, just on that regulation point, one of the interesting aspects of generative AI is the prompt, the user prompt is kind of part of the software design in a sense. And so I heard a few talks that were really stressing that the prompts really should be kind of predefined as part of the design and validation process, and the users just take advantage of predefined prompts, because then you can go through the proper design process, validation, regulatory analysis, monitoring, that sort of thing. But if you leave that too much up to the user to sort of type whatever they want, whenever they want, then it could be less safe in a sense, because you kind of have a lot of decentralization a part of the software design. I don't know if you agree, but I thought that was kind of an interesting point on that.
It is. That's an interesting perspective. And actually, if we as an industry want to go that direction or have to go that direction, it's very similar to what we have today in radiology with all the deep learning algorithms.
Yes.
Right,
yes.
which are also like frozen at the point of regulatory approval.
Yes.
And we are also here not really leveraging the full potential of deep learning because it doesn't get better over time, right?
Yes.
Automatically,
yes.
It doesn't. Yeah. So we have to provide like updates and so on. But yeah, interesting. It looks like very similar, and therefore I think we eventually do not need new and additional like regulation, right? Because we have existing frameworks, and we just need, like, I would call it the regulatory guidance, right? Yes. I mean, those regulators need to tell us, hey, what is the way forward in terms of LLMs, Gen AI, foundation models? But the frameworks themselves, I feel like they are there. Yeah, and we should leverage them going forward as well.
I mean, there are things to fill in, like you mentioned, the FDA, the restriction on kind of retraining, let's say, or how retraining works. You know, that's kind of a new concept that regulators have to weigh in on. And I think with LLMs, there are concepts like what I mentioned, you know, the off the cuff prompting that users might do, how that should be handled from a control point of view, in a sense. So there are a couple things that it would be nice if regulators weighed in on and provided guidance and that that kind of thing. But us as an industry, you know, we're also, of course, incented to build useful, safe products. So, Absolutely. You know, we also need to come to conclusions as to what's the best way to use this technology.
I fully agree. I'm with you. And Don, I think, right, we as an industry can also maybe provide inputs and let me call it here as well, guidance to regulators, because we have quite some experience in those spaces. And maybe together, right, in collaboration, we can find the right way forward.
Back on the summarization use case, there was one very interesting discussion that was had in one of the sessions. This was actually a panel that I moderated. And we got to the point of what is the use of summarization now anyway in the report. So the concept was, you're a physician, you're writing a report, you know, a visit note summary or something like that. You're summarizing the patient's situation. And then at the end, you're saying, okay, therefore I thought this and I did that, right? And then the next person reading that report is reading this and, you know, this big summarization, and they're trying to just call out, you know, what you did and why you did it. And so essentially you have LLMs generating big report, and then you have LLMs on the other side shrinking it down to just the facts. And if LLMs really do a great job summarizing on the fly, you know, then maybe our documentation requirements can lessen over time to be just the clinical reasoning, you know, documentation that physicians obviously need to do.
I mean, sounds great. There is this one thing. I mean, when we want to in the future, when we want to like feed an LLM, right, to provide, like, let's say, a summarization or whatever content, and then you take this content and feed it to another one for a follow-up task. We just need to make sure, right, that we are not at some point, right, due to, for instance, hallucinations, get really artificial information instead of real patient-related information. I mean, this is something we have to be very careful with. And this, Don, leads to another good question here. We just talked about regulation, but I've been at the European Congress of Radiology a few weeks ago in Vienna, and there was good conversations about, hey, regulatory approval is not equal to the evidence of clinical value. Which obviously, of course, is. Do you see also in the US, like, clinical evidence really building up?
On the LLM front, I think most of the excitement is around productivity, I would say. So not necessarily clinical impact, but administrative reduction. So if you think of the ambient documentation use case, it's sort of giving physicians back time And like you say, they can focus their office visit on the patient relationship and paying attention and, cementing that relationship and taking away that administrative time. Other use cases like, proposing patient portal message responses is another use case that people are talking about. That again is saving administrative time, and it still has a human in the loop. So, so those I think are the areas where value is being targeted right now with generative AI, at least. So the evidence is more, time reduction, productivity, hopefully reduction in burnout, physician satisfaction improvements, things like that, which I think are reasonable targets. I think sometimes people started with AI trying to outdoctor the doctor, in a sense. And I'm not sure that's needed as much as helping our physicians, helping our clinicians, especially with the administrative tasks. If we can bring technology to the table and make their days easier and more productive, I think that's a good start for AI.
I fully agree. I mean, efficiency is definitely something you should have as a KPI when you want to implement something like this. And right when I talk to other people in other industries, they also think about like cost reduction as a additional KPI.
Sure.
Because efficiency and cost is not something you can just put together. We have seen a lot, companies, institutions leveraging or jumping onto the, let's say, LLM bandwagon. They see an efficiency gain, right? Like coding, which you know very well. You can, be much more performant, but it doesn't. It's not equal to cost saving, because you would eventually not reduce your workforce, but you make them just faster and more efficient, right?
Yeah. On the clinical value topic, Jan, another interesting discussion I saw at HIMSS. They were presenting more and more complicated use cases. So one was summarizing a patient chart. The next one was, what are the diagnostic options that you would recommend to do next with this patient? And then given this diagnostic result, what treatment options should I consider? And we were talking about the accuracy of the model in those three use cases. And you can see the model is being given more and more complicated tasks, more clinical reasoning tasks versus a just the facts task, and then more clinical reasoning. And the panel was discussing whether the model was getting worse depending as the task got harder. And the answer was no, actually. That it does a good job, at least providing a universe of options. Sort of the clinician question, what else can this be? Or what else should I be considering? That sort of broadening the mind, task. The LLMs are pretty good at. And even this hallucination is usually used as a negative. But this notion of kind of being creative and sort of broadening the aperture is one of these things LLMs can do. And so there's certain clinical scenarios where that's valuable. When you're trying to narrow in, it's not as appropriate. I think the physician needs to be the leader. But when you're trying to broaden out, sometimes it just helps you expand your mind. So I thought that was an interesting discussion as well.
I mean, that's very interesting. And look, I think a lot of us, using tools like ChatGPT or Copilot are using those tools exactly for this purpose, right? Someone, like a partner that helps you think. And I think this is a great use case. And especially to kind of, as you said, broaden your thoughts, think out of the box, think around the corner. I think that could be very helpful in healthcare as well.
I thought that was kind of interesting. The other thing I'll just say from a themes point of view in AI was just a lot of discussions around bias and around governance. So governance, I think was especially clear, is that each organization wants to deploy these AI models and are trying to figure out how their governance would work. They know they need it. They're sort of designing their stakeholders, their operating mechanisms around it, and how they put all the pieces together: the design, the validation, the vendor selection, the monitoring, the regulatory impact. So a lot of good, helpful discussions, I think, on that topic. And then bias, there was a lot of sessions on bias that were fairly, I think, just awareness oriented. I think bias, we haven't come as far in terms of here's how you manage bias out of these models. Here's how you design it out. Here's how you monitor it. You know, it hasn't made its way to a specific like cookbook, I would say. But we're sort of at the awareness stage that everybody needs to know that you've got to look for bias, validate these models, look at ethic implications, these sorts of things before you put them into production. And so I think that was good. I mean, bias, I mean, awareness is a good first step on that topic.
Oh, absolutely. And look, I mean, right, when I look back the last couple of years and think about vendors in the healthcare space developing and selling AI, I mean, you have built such a model, you productized it, and then you sold it, right? And then you have been in conversations with, let's say, the health system, the healthcare provider, how it goes. But I think going forward, we need a kind of end-to-end approach to what I would call MLOPS, right? So really making sure that and factor this in on day one when you start developing your solution. I think this is very important in the future. But as you said, I think everyone has understood this now.
Yeah. I think that was progress for sure.
Yeah. Don, another quick question to all this. I mean, what you just described, and maybe I'm wrong, right? But so far, right, LLMs, Gen AI, right, all the use cases you just summarized is a lot about like textual information.
Yes.
Yes. Text voice eventually. But what I'm very excited about when I think about Gen AI is this opportunity that it very likely will open a door for us into this world of multimodal AI.
Yes.
Right? Which I believe is so much needed in healthcare. I mean, have you heard or seen anything around this at HIMSS as well?
I did. There was a couple of very interesting use cases around imaging plus text. So I'll give you two. One was a use case where a physician had documented an ED visit on a napkin. So, and it was cryptic, you know, 45M HX CAD PFD, you know, so 45-year-old male, history of coronary artery disease, peripheral vascular disease, and, you know, the rest of the napkin was all filled out. The demo was, hey, I took this picture, can you turn it into a structured note? And it worked beautifully. It was really interesting how the model was able to read that image, understand those acronyms, and they weren't like cryptic, like just the kind of notes I write for myself or only I can read. You know, they were kind of popular acronyms, you know, written kind of legibly, but nevertheless, it digested this in and it wrote a beautiful note. And it got me thinking, you know, there's a multimodalness to technology, like these models, but there's also multimodalness to the world. You know, there's audio, you can imagine physicians or decision makers writing on a whiteboard, documenting on napkins, you know, other kind of approaches can be brought into, you know, play more with these models. And the other example, which was really cool, was a flow chart. So it was a flow chart. It was actually a radiology example. And the flow chart had a decision tree around, you know, if you're seeing this in the patient image, it was a CT of the abdomen. If you're seeing this in the liver, then, you know, then you look for these diagnoses. Otherwise, you look for these. And it kind of had a 4-step flow chart. And the case was, can you take this patient record? Can you take this flow chart and step me through where you see the facts in the record, step me through the decision tree of the flow chart? And that worked beautifully also. So that was kind of interesting because you have clinical guidelines that are simple in a sense, written in flowchart form, understood in flowchart form, and those can be more put to play now that LLMs can digest or models can digest images as well. So I think there's going to be a lot of really interesting use cases, just like you're saying, from a multimodal point of view. And the other thing is, right before we started recording, you were talking about kind of establishing trust in AI models in the industry,
Right.
and that being an important task for people like us. And I think this is a good example of that because people understand flowcharts, they understand guidelines that they've been using for years. If those could be better incorporated into their workflow using techniques like this, then they can see, oh, the AI model is just putting 2 and 2 together. I know what records look like, I know what my guidelines look like, and the AI model's helping me sort of digest these together. I think those, those would be examples of building trust based on what they have been using for years.
Absolutely. Yeah, as long as it works well, right, and the result is the one the user expects, and the user experience is great, right?
Yes.
So I think we all in this industry building those solutions should really focus on user experience.
Yes.
Don, you just mentioned trust. Maybe I just quickly elaborate on why this is important, right, to you, to me, to others. Look, I think we have done, right? And when I say we, I really mean the healthcare, let's say IT, AI industry. We have done a lot of work in that space, even if you know very well, right? We are way behind in terms of AI adoption compared to other industries, but a lot of good stuff has happened. I mean, great products have been built using AI solutions, right? We worked to integrate them seamlessly into existing digital solutions. We have done a lot of effort, but there is this one thing, right, which you just mentioned with trust, where I believe we have not done enough. And maybe this is one of the reasons why we have not seen broad adoption of AI across the board, across healthcare. And it's really about, right, building trust with those who are going to use those solutions, right, healthcare professionals, for instance. We have to demystify AI for them. We have to explain them the terminology. We need to talk about, hey, what is this black box? What is deep learning? What is an LLM? What does it do? We don't want them to become like data scientists, of course, but they need to understand the basics. And that's what I'm trying to do in my work. And hopefully this helps to kind of start building this trust. And with this, accepting more and more AI coming into their daily work.
Yeah, I would also say that sometimes we talk about AI when we shouldn't. If you think about like apps on your phone, like I have Spotify or podcasts or maps or something like that. Those applications use AI to provide a better experience for me. But they don't there's no dialogue box that comes up and says, "Hey, I'm using AI. Aren't you impressed?" It just works better. And I think that there's some use cases where we don't need to make AI the front and center, just the workflow and a smarter application that seems to anticipate my needs. Those kinds of things I think can be equally valuable. There's certain use cases where you kind of need to understand it, but there's certain use cases where AI shouldn't be the front and center. Just a better experience should be front and center to the user.
I fully agree. I mean, it's similar to like digital health, right? I mean, at the end, hopefully, we just call it healthcare at some point.
Yeah, sure.
Sure. And I mean, I like to generalize sometimes when I speak about AI or machine learning or whatever it is, but sometimes it's required to be very specific, right? Because AI can mean a lot of different things, as you know very well.
Yeah. Good. Well, that was so I thought it was a good HIMSS. I enjoyed it, and certainly everybody is trying to be an AI expert, which was kind of interesting as well. And I got a lot of complaints that there were a number of superficial AI sessions, and I just think that's kind of the cost of our whole industry moving up the AI knowledge curve. But I do think there was more depth than last year, I think, on the topic. And it's really up to people like yourself and myself to some extent and others to continue to sort of flesh this out, build education, trust in the industry, and ultimately build valuable products that work well and that are safe for our patients.
Great. That's a great summary, Don. And look, as you just say this, I feel like, or I just want to point out that it looks like the generative AI is going to be such a transformational technology. Everyone in the space should start familiarizing themselves with what it is, right? And even if it just means, hey, play around with Copilot or ChatGPT, but get a sense of how impactful this can be for your, I don't know, personal life or for your professional life. Really get used to it. I think that's very important. And last but not least, it sounds like HIMSS again was a great event, and I should come back to it next year.
You should. It'd be nice to see you there. Very good.
Perfect. Thank you very much.
Yep. All right. Nice to see you. All right. Thanks, everyone. Again, you can post questions in the chat. We'll be happy to answer those, and have a great day. Bye, Jan. See you later.
Thank you. Thank you. Bye-bye.